Hello, my name is Stephen Hedges, and I'm working on my master's degree in public health here at UAMS. And today I'd like to go over the HIV intervention in India in light of community-based participatory research principles. So bear with me here. I've got a bit of a throat bug here, but so yeah, we've all gone over this study, so I won't spend too much time with the overview. Suffice to say that it was a multi-year intervention that focused on addressing the high HIV prevalence rates in 100 target towns across southern India, primarily in the Tamil Nadu, Karnataka, and Andhra Pradesh regions. The study aimed to lower HIV prevalence by changing the attitudes of male clients about condom use with commercial sex partners and improving condom education. This included instructing on proper use of a condom and providing accurate information about the positive health benefits of condom use and correcting incorrect negative information regarding condom use. And lastly, they aimed to increase condom accessibility to those in need. And all in all, these efforts combined saw a dramatic increase in the rate of consistent condom use within the commercial sex encounters. At the start of the study, it was 62% consistent use, and by the end of it, they had reached 81%, well above their intended target. So before we go any further, we need to actually define community-based participatory research. So what exactly is CBPR? It's an approach to research and interventions that incorporates the community being studied into every stage of the process. And this is an approach that has value in many different research scenarios, but its efficacy in public health research and interventions is pretty well documented. Um, Researchers and the community work together to do basically all of it, but many, many things, including but not limited to the decision-making process, all across all the whole spectrum of the study, what to actually study, who even defines the community, like who gets to define the community, who is in the community. Um, the researchers and the community itself dig in and work together to figure out what type and use of the research they will be utilizing. All too often, the dissemination of the findings is solely up to the researcher, but when you're using CBPR approaches, that is a collaborative effort on the part of the researchers and the community itself. And this can be done by committees deciding who gets copies of the findings, who gets to present at conferences, and it's often that you want the community members or representatives of the community to go with you to those if you're the one doing the research. So I know this slide is a little cluttered, but I tried to be as concise as possible. Um, so we have defined CBPR, but we need to go over its principles. Its implementation usually breaks down into roughly 9 separate principles, and these are those. Uh, the principles are community is a unit of identity. Um, you want to build on strengths and resources of that community. CBPR will facilitate collaboration for all phases of the research and subsequent interventions. CBPR will foster co-learning, so not only are the researchers learning things, but the community itself will be learning things as well. So it goes both ways. CBPR aims to balance research goals with community improvement aims, and sometimes this, from a research point of view, can seem like a hindrance or something that's slowing you down, but it's critical in long-term sustainability, which is another one of these core principles. CBPR will always have an ecological perspective for locally relevant issues. So we'll look at not only at what the problem is, but what factors in the environment are leading to it, or are contributing to it. CBPR research and interventions are typically cyclical and have incremental systems that are developed and used. Um, and another core principle is the dissemination of results to the community and the researchers. Obviously, the researchers get it, but it's important that it doesn't just go to some article that you have to pay $50 to a subscription to. Like, it needs to be accessible to the people who partook of the study and who were studied In fact, like, it needs to be readily available to all. So moving on to this study in particular, the first thing we need to ask ourselves is who was the community in this study or intervention? Who defined it? In this particular case, it was the researchers who defined it. But firstly, there wasn't really a single cohesive community. There were around 100 distinct communities defined by location. As best I could tell, the communities themselves were not involved at all in defining themselves. The researchers did this for them geographically, based on information gathered by a third party that was itself also not part of the communities that were being studied. And the information I'm referring to, of course, is the HIV prevalence rate. But each of these communities, while distinct, did have shared characteristics that the researchers identified, and these included lower income as a whole, less access to healthcare facilities, lower education, and also high rates of commercial sex interactions. So we're going to start with how the CBPR principles were kept to in this study. So while the communities themselves were not self-defined, they were the pools from which activity leaders were drafted. So most of the people taking part in the groundwork were drafted from the communities that were being targeted, or at least nearby. Planning and organization of events was decentralized and handled on a community level. This was done in part to assure that no language barriers added to the difficulty of this huge undertaking. In fact, there are so many languages in India that I couldn't find any two sources that cited the same number. They ranged from 150 to 1,652 different distinct languages across the entire country. So the fact that it was decentralized and employing locally did use the strengths of the local community, at least for communication purposes. And they did use ecological perspectives by including environmental factors in the assessments. And these CBPR principles, all of them, but particularly the decentralization and employing locally, that format helped more rapidly adjust the message to reduce fatigue over the term of the study, and just find out what was working well for that area in general. Honestly, it was easy to pinpoint the CBPR failures in this study than it was the successes. That's just because there were more failures than successes. This was definitely more researcher-driven approach than it was a community partnership, even though there were some facets that included some community partnerships. But onto the CBPR failures, they didn't really include the communities themselves in the decision-making processes. All the questionnaires were actually made by the researchers themselves and tested on control groups. Responses were then gathered and they tweaked them and tried them again. But there weren't really any true partnerships that I could see except between PSI and the researchers themselves. I didn't really see much in the way of dissemination of the results to the communities themselves. There was little input from the community beyond the testing of the questionnaires and I guess responding to focus group questions. Though the decentralized workforce did have a lot of lateral freedom to rapidly adjust to that. And actually, the community itself didn't really sign up to be studied. It just kind of happened. And while this is, in some situations, definitely a concern, I would argue that in this particular case, the benefits that they received from the study would probably far outweigh any concerns that someone might have about having data like this collected. Now, I don't want to be too harsh on the researchers. I want to lead off this verdict section with a reminder that this was an incredibly successful intervention based on solid research and health behavior model utilization. But perhaps sustainability of these new health behaviors could have been improved by using more CBR principles in their approach. If they had actually used CBPR principles, they may have discovered other possible problems that they left unaddressed, or maybe even it's possible that there are underlying issues of education disparities And if so, there's definitely no real true addressing of that issue. They helped the population at that time of the intervention, but that information may not spread into the future. It might not be passed down, or it may be passed down incorrectly. Um, it just kind of depends on whether or not the education efforts stick and last in the community through the partnerships left behind after the intervention was completed. And furthermore, the communities themselves were not self-identified. They didn't choose to be studied. They didn't really have much say in the matter. There was definitely a lack of collaborative and equitable partnership between researchers and the communities themselves, and there's, as a result of that, there was limited co-learning. The people being studied got the intervention, and they therefore certainly received some education, but the researchers themselves didn't learn quite as much as I feel like they could have if they had gone in on the ground level and worked with the communities more closely. So overall, the CBPR principles were not thoroughly or rigorously used in this study, and I feel like if they had been, it could have been even more successful than it already was.